We are on week 2. Next week, you do not have class. It is Martin Luther King. So no uh, class. That also means no quiz. Okay? So that means what I have other of my pediatric professors has requested that week 3 quiz be given with your exam on week 4. It's the same stuff you're studying, right? So it just makes sense just to put it there for you. So we're going to be doing your this week information is going to be on your exam for week 3, okay? Week 3 is school age and adolescence. That's going to be on your exam with your quiz, okay? And there's nothing crazy about those areas, so I think you guys are going to be good there. And yes, I've already made up that quiz. It's already ready to go for us.
So it's two separate, a quiz and exam, or everything is included? I want to get clarification.
They're separate because you have to
Okay.
do on Canvas, you've got to do your quiz, and then you have your exam soft, which is your exam. And on that day, we're going to figure out what are we going to do first. Maybe we'll just have you take your quiz first or take your exam first, then come back, and then we'll take your quiz. Whatever you all decide you think you want to do.
So
So
this is
you all
on
tell
week,
me.
sorry, this is in week 4, not in week 3, right?
This is week 4. Week 3, which is next week, we don't have class. It's Martin Luther King. So because in fact, there's 1, 2, 3, 4, 5. There's 5 Monday areas, believe it or not, at 2 o'clock. There's 5 classes being held. And because of that, when one class doesn't get the quiz, nobody gets the quiz. We always do it all the same. So if you don't have a class, then they're not going to get the quiz. And we're going to do them all the same for every single class. It'll be done with week 4 with the exam, okay? So this week, interesting week, probably, I think the funnest week for me. Infants, toddlers, and preschoolers. These are all your young kids. And how do we work with these children? My last job that I worked the last 10 years was in a very high level trauma center emergency room. And I would always give the young nurses those quote urgent cases. And I would always go into the more rapid care where we're turning over children quickly, a quick upper respiratory, strep throat, and ear infection, easy stuff. And I would always do those things. But something, it doesn't mean that they're easy because sometimes the easy ones being placed in the non-urgent area, those are the ones that are going to go sour quick and crash and burn, and you're going to need help with. So, emergency room makes me, with my eyes open a little bit more. So let's go ahead and let's start with our PowerPoint for this week. Now, I put the PowerPoint on the announcement. I'll also put it on the announcement when I put your recording. Remember, you always have 2 announcements from me. One is the information for this week, and then after class, it will be a recording, and any handouts that I would have been giving you will be also included on that announcement. You did get one more announcement this week because it was Dr. Brown, and she wanted to make sure that where are you going. Apparently, some students were asking other students in the same campus, where is your link for this class? And that was the wrong links. They went to wrong classes and stuff like that. So she just wanted to be sure that everybody's going to their class that they're scheduled for, okay? Because she saw some issues. And that's why that announcement's there. So let's go ahead and let's look at our infants. So, as I said, I'm amazed by that first year of life. That first year of life, they go from 7 pounds at birth, and they're double that by 6 months, and then they triple their weight by 1 year old, okay? Their height for the first 6 months of life gets 1 inch every month. So they're growing, they're gaining weight, they're getting longer, and it's so much growth that these children have to eat to try to keep up with all that growth, don't they? You've gone from a small baby who can't even lift their head up, and at the end of the year, they've tripled their birth weight, and now they're running around and cooing and talking and making their needs met, right? So as they get older, the respiratory rate, the heart rate, we know as a neonate, and I've mentioned it, their heart rates are 140 to 160 at birth, at first 28 days of life. Their respiratory rate is 40 to 60. So they're really fast, breathing fast, but it's normal. That's at rest, that's at sleep. So as they get older, the heart and the lungs become more effective. So the heartbeat is less and the respiratory rate becomes less because they're more efficient. So by the time we become adults, that heart rate is now 60 to 100, not that 140 to 160 that we had at that neonate, okay? Now, another thing that happens with your infant is babies are born with all of mommy's goodness, their blood, their immune system, all of their hemoglobin, hematocrit, that's all from mommy, right? Well, we know that babies don't start making their own blood till somewhere about 5 or 6 months, which means mommy's blood cells are going to die off because that's what blood cells do. They live a certain amount of time, they do what they need to do, and then they die. So now they're dying off. The hemoglobin hematocrit is going down and down, and we have what we call a physiologic anemia, and that's somewhere between 3 to 6 months because mommy's blood is going away, it's dying off, and the baby cannot support or make its own cells yet. So we don't have iron, right? And oxygen. So if those numbers get very low, your infant will be symptomatic. They'll be breathing harder. The heart will be beating faster, trying to get that little bit of oxygen and iron around to the baby, right? But usually, by the time that happens, the baby's now it's at 6 months, right? That's where mommy's iron is going away no more. That's when we start feeding them iron fortified formula and food that has iron in them. So we're replacing that iron slowly, okay? So the body sort of knows what to do and when to start to eat to help replace those sort of things. Another thing that we monitor growth with is that fontanelle, that soft spot. So we have one in the back, the posterior fontanelle. I'm telling you, by the time you know it's there, it's already closed. 6 to 8 weeks, it's gone, and it's very small, usually, the one in the back. The one on top, which is called the anterior fontanelle, that stays open till almost a year and a half. Now, why do we need to know that? Well, what if it doesn't close, that posterior fontanelle, and the baby's 3, 4 months old now? Why? Why didn't it close? Is there hydrocephalus? Is there a brain tumor? Is there something? What's going on? Because remember that cranium, that fontanelle closes the bones to protect the brain. So now it's not protecting. So what's going on in there? Okay. Another thing, if we don't have that anterior fontanelle, I think probably this is one of my big assessment places on an infant is that fontanelle. I can tell you their fluid balance just by looking at a fontanelle that's just flat, sitting there when the baby's quiet, and maybe a little bulgy when they're screaming and crying, but it's flat. When we see a bulging fontanelle, that's too much fluid on that child, could be a hydrocephalus. And then sunken in is probably dehydration. But along with sunken in fontanelle, you're going to see sunken eye sockets and crying and no tears and elevated heart rate and decreased blood pressure and decreased urine output and prolonged capillary refill, et cetera, right? All of those things are all about a fluid balance. And I could tell a lot by that little fontanelle there, which makes you go looking for those other things, okay? Another things it's talking about is that auditory acuity perception. At birth, each eye works separately. So there's no way to get depth perception because you need both eyes to focus in to be able to get something. So usually about 9 months is about when that starts to occur, when the eyes are now starting working more together, and then they can grab for stuff and reach for it a little bit easier. Now, the immune system, we know that first year of life, that baby needs to build up a nice immune system, right? We know that mommy's given her stuff to them, and now it's going to slowly go away. So now that baby needs to build up its own. And how do we do that? Well, we start giving those immunizations by 6 to 8 weeks. Look at that. Antigens and antibodies can be made by giving immunizations. And that's why we start at 2 months, 4 months, 6 months, and we hit them with a lot of them. That hepatitis B at birth. And then I know that's sort of up in the air now. There's new research about it, but our book still says Hep B at birth, and that's what you need to know, okay? And you look at this baby and you see that cheesy stuff on them. That's actually a protection that the body is given the skin so that protects them from infection. Now, thermal regulation, we've mentioned this before, but remember, infants at birth cannot regulate their own body temperature. A baby is born and they're coming out of a wet, warm environment. They come out and they come into this cool environment and they get chilled quickly. So they need to be dried off immediately. Usually they put a hat on their head because a lot of their heat comes out of their heads, and they're placed underneath a radiant warmer, whether it's into a isolette or whether it's on a warmer or whatever it is, but heat is going to be given to that baby because we want to protect and keep their normal thermic during this time. Now, there are fine motor skills and there are gross motor skills that we can look at a child and we can sort of figure out how old they are by the way they're using their fingers. At birth, they're always touching their hands. This is where they start with, and they're starting to learn their fingers, right? And then somewhere prehension or grasping objects, somewhere about 2 to 3 months, it becomes this palmar grasp. But the first thing is going to be that reflex. So we put something next to that baby's palm and they grasp it. And most mommies go, "Oh my goodness, my baby's given me a hug." Please don't tell that mother that that was a reflex. Let them think that that baby's just giving them a hug and they love them. Because if they're in a hospital and you're involved, most likely they're in a newborn ICU, or, we're trying to work things out for that child. So don't tell that mother that it wasn't a nice hug from the baby. Once they go from that reflex grasp, it goes into, "Ooh, I see it, I want it, I grasp it." And it's called a voluntary palmar grasp, okay? After that, somewhere about 6, 7 months, they start transferring the rattle from this, or the block from this hand to this hand. They just start transferring things around. And then about 10 months is what we call a pincer grasp. Think about a baby in a high chair with a bunch of those little puffy things or Cheerios. And they take their hand and sort of smoosh it in their face to get a couple of those little things in their mouth. Well, that's a crude pincer grasp. Then they get to the point where they pick up one at a time and very nicely pick one at a time. That's called a fine pincer grasp. Then what do we do with the fingers? Now we can take things out of containers, and that's about 11 months. And by 1 year old, they should be able to build a tower of 2 blocks. It doesn't mean they might do 3 or 4 blocks, but a minimum of 2 blocks is what they should have. So remember, fine motor, you see questions, think of F, fingers, things to do with the hands. And that's a test for you. Now, the other sort of movement is gross motor. Think about get up and go, go, go. This is movement, whether it's wiggling, rolling, sitting, all of those things. These are part of things that children do. So what's the first movement that they do? And that is going to be they lift their head. They have motor control their head 2 to 3 months, okay? Before that, their head falls. That's why, oh, be careful, and their head's always bopping around when they're very young. You're like, oh, be careful of that neck, right? Be careful of that head. Now, that's the first thing. The next thing we need to warn our parents about is now all of a sudden between 5 to 6 months, they're rolling from their bellies to their back or abdomen to back or back to their bellies or to their abdomen, okay? Why do we need to know that? Well, this is when they start rolling off of changing tables, couches, beds, chairs. I'm telling you, I've had infants come into the ER falling off of everything. And at that 5 to 6 months of age, they all of a sudden they've rolled for the first time. They should be aware that this is the time frame that they need to be careful and to buckle them in to whether it's their changing table or if they're sitting in a chair that's bouncing around, that they're locked in, that they are secured because they will roll off. Another big fine, a gross motor thing is sitting. A lot of questions you'll be seeing about sitting in 8 months. Sitting unsupported at 8 months. That means you don't need pillows or blankets or anything. They sit by themselves. And then the next big one is going from their back. They can sit up and they can sit. That's at 10 months. That's a bigger thing that they do. And then we know the last of gross motor skills for your infant would be walking or attempting to walk, and that's at 1 year old, okay? So you've got the basic fine motors and gross motors here. When you're answering questions, make sure you look. Are they looking for fine motor, which is things with your hands, or gross motor, get up and go, 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 movement of any sort. So gross motor is cephalocaudal, which is head to toe, right? Cephalic, which means we lift our head first. They should be crawling right after they start rolling is when they start crawling, about to 6 to 7 months. And then do you know what creeping is? Creep is on the side of a coffee table or on the side of a couch that they creep along holding on, basically. That's what that means. And then about 11 months, of course, we're trying to make our babies walk quick. So we're holding their hands and trying to get them walk. That's walking with assistance. And then it doesn't mean they have to walk at 1 year, okay? It's that attempting to walk. My children never walked at 1 year. They ran at 15 months. They went from no steps. My daughter, the first time that this gentleman that was watching my kid for me said, yeah, your daughter took their first steps today. I said, how many? They go, 76. I said, that's not walking, that was running. It was a one after the other after another. I'm sorry, that is running. And that's what my kids did. And even my grandson that was close to me that I saw. Now, nutrition, nutrition, nutrition. First 6 months of life, babies should only get breast milk or iron fortified formula. If they're getting breast milk, they should get vitamin D as an oral supplement. It helps with muscles and bone sort of formation. They need that, okay? Now, how do you know a baby's getting enough food? And I hear this repeatedly with parents, especially in the newborn ICU. So in the newborn ICU, we measure everything and we look at the bottles and we look at the syringes and we're measuring to the last 1 ml of formula or breast milk, don't we? And then we weigh the diapers. Now, these babies go home and they're used to measuring every little thing and looking at the diapers and whatnot. How are you going to tell that parent to watch that child at home, know if they are getting enough to eat? Well, first of all, how do you know they're getting enough to eat? They have 6 to 8 wet diapers every day, whether it's stool, because breastfed babies have a lot of stool with their urine, or it's just urine, or it's just stool. It doesn't matter as long as there's 6 to 8 wet diapers. The second thing that we know that they're getting enough nutrition is what? They're gaining weight. As simple as gaining weight. We know that baby is going to go back to the doctor in 2 weeks after it's sent home, right? And they're going to be there at 2 months, 4 months, 6 months, and we're going to be measuring every single visit. Are they gaining enough weight? Are they growing enough? And all of that's dependent on nutrition, nutrition, nutrition. Because if they're not eating well, they're not going to grow well. And cognitively, they're not going to be rolling over by 6 months. It could be 9 months. That's how much nutrition affects a child. Now, that first 6 months of life, we don't give anything by mouth that's just not milk. One time we do, and that's only with reflux. We'll put a little rice cereal in the milk or into the breast milk, whether formula or breast milk. We'll put a little bit of rice cereal in there. And yes, they're not going to digest it. Yes, you're going to see it in the stool, but the baby's not vomiting, spitting up the calories of formula. She's getting all the formula in. So the benefit of keeping the milk in, getting the calories and nutrition far outweigh that rice cereal. They're not really going to digest most of it, really. Okay. By 6 months, they say the baby's GI system's going to get better. Now, have you eaten corn lately, anybody? Our GI symptoms as adults still has corn in our stool, doesn't it? All right. It's just part. It's normal for infants, even at 9 months, 12 months, 15 months, to have little pieces of vegetables and stuff in their stool because they don't digest all of it. And I just use corn as an example because we know as adults, our corn is still going to be seen. So think about that's the adult. And that's the baby. Same thing. It's normal. Now, the second 6 months of life, we start introducing foods. Remember, this is the time where they've been breastfed the whole time or just bottle fed the whole time. And now they start to need to eat solid foods. We're going to introduce one at a time every 4 to 7 days. Now, we don't put two at a time because what if they were allergic to one of them? Which one were they allergic to? So, one food at a time. You feed it the same one for 4 to 7 days. If there's no allergic response, which could be abdominal pain, diarrhea, vomiting, rash, could be all of those, or some of those or all of those you would see. Sometimes diaper rash is one of the big things we see with food allergies with children. So again, knowing what the allergies are and then not giving them them. Now, infants, some of them. And I had one student last term who had a child who had very, very bad eczema. In fact, that's what she did her project on and shared pictures with me and what she did for these allergies. And it was all food sensitive. So if we have a child who's food sensitive, know that we can desensitize them. They go through all of these allergy testings and all these desensitizations to try to get them to be able to eat as much food as they can. Also know that if you have allergies, let's say to, lactose, which means you can't have milk. Remember, as you get older, you might have a calcium or iron depletion because you're not getting that milk, right? So again, what you can't eat, how do you replace it in another way? So sleep. Infants sleep a lot, right? They eat, you change them, you burp them, you play a little bit, and then they're asleep, hopefully. We know breastfed babies want to be fed more frequently. They actually consider breast milk clear liquids. It goes through them that quick. Usually they eat like every 2 hours. Not uncommon, and that's absolutely fine. They're actually saying you don't have to use walkers and swings and playpens, but tell that to any new mother. They're going to have that baby in that swing because they love that swaying thing. But again, that's a choice of a parent. The book says it's not necessarily, but I think they really enjoy it. Dental health. The first tooth that they could possibly get is at 6 months. It doesn't mean at 6 months your baby's going to get a tooth. What that means is if you are 12 months old, so that's a 12, and you minus 6, you could have a possibility of 6 teeth. Okay? Now, again, my kids never had teeth at 12 months. At 15 months, 6 teeth came in at the same time. So again, as long as they're getting teeth, it's okay. And then, of course, as they're getting teeth, you gotta protect them. And that is just toothbrush, no toothpaste. You can use fluoride at 6 months on these children and just keep the teeth clean. At bedtime, in the bed, no juice bottles, no milk bottles, because that's milk, that's sugar, that's going to rot teeth. So only water, okay, if you have to. And then no bottle propping. It just holds that milk, that sugar on the teeth, which will rot the teeth. And we don't want to do that. Immunizations, there's a bunch of them, aren't they? So which ones do you have to know? Well, you have to know Hep B is at birth, right? You need to know measles, mumps, rubella is about 12 to 15 months. Varicella is a live vaccine. So you need to know that if you're giving that to children who have an immunosuppressive disease, they can't get it, right? Or they need a different type of it. And then what about our influenza? Influenza, we can start that at 6 months old. Okay, so we'll be going over those some more as we go along. Okay, there's lots of them that we give children. Colic is a problem that some kids get. It's just basically gas. Many of them do grow out of that somewhere between 3 to 4 months. Sometimes it has to do with food and intolerances. It's just a very frustrating time for parents because they can't rest because that baby's always sleeping. They're always with gas in their tummies. As in, there are sleep problems, dysomnias and parasomnias. They sleep a lot, not enough, bursts. This is absolutely normal. And then I mentioned it quickly, but failure to thrive, FTT. This is when a child is not gaining weight the way they should, which is telling us cognitively and growth, fine motor, gross motors, cognitively, they're not where they should be. They are behind, and it all has to do with nutrition. One of the things now, especially, we're concerned about is plagiocephaly, which means flathead, toaster head is some of the things that we used to call them, especially the premature baby. We sometimes have to lay them on one side and we can't move them, and the side of the head become flat. So today, we promote that we put all children for sleep on their backs, not on their sides, not on their tummies. They should be on their backs. This is decreasing sits death in children. Parents are now worried about the back of their head with the hair coming off and flattening the back of their head. And it is a concern. So what would we tell our parent? Well, this is why we do tummy time. We do tummy time several times a day, right? And kids' heads are very soft and malleable. I mean, they mold very quickly. So if we get them up off their heads, it takes just enough time off their head so that it can shape out and so that you won't have the flat head. Another thing that could be used is that what we call a helmet head, the one on the bottom there, that's done on by neurosurgery or the neurosurgeon, where they put it on their head so that the kid can get rounded out and no more flathead. It's not always needed, but in severe cases, we do use it. Another thing that happens in kid is dermatitis to their little tushies, right? Diaper dermatitis. I think this is probably the hardest thing for children and for parents. When these children urinate, even if you put a nice barrier on there, it burns. And the problem with diaper rash is usually at night. You get that baby nice, comfortable, and slathered up with all of the creams and lotions and put them to bed, and then they urinate or stool and they're up because it burns and it hurts. So we don't want diaper dermatitis to occur. It can occur for certain things. It could be, as I said, food allergies. My younger kids could not wear Huggies. They could wear Pampers, not Huggies. Now, My other children were the opposite. So we put one diaper on them of the wrong brand, and it would look just like that in a couple hours. That's how highly allergic they were. So, how would we teach and show our parents? Well, we have a diaper rash. We need to wash it with soap and water, pat it off, all right? And we need to put some sort of barrier cream on there to try to protect it. We need to be aware of foods that we've been feeding them and the diapers that we've been putting on them. All of these things, creams, lotion, shampoos, cleaning detergents, all of that can affect a child. So that's what they say, maintain the same things, the same foods for longer periods of time. Another thing that occurs at birth is what we call cradle cap. It is seborrheic dermatitis. It's that white, flaky sort of things on the scalp, and it's just dry skin. So, how do we get rid of it? I know some parents of little girls want to put cute little bows and ribbons in their hair, and with this flaky cradle cap, they don't want to bring that attention there. So, we need to get rid of it. So, how are you going to teach them? Well, you wash it with normal, mild soap and water, like you would any baby shampoo stuff. And then you're going to massage some baby oil or a moisturizer in there. And then slowly a fine tooth comb, just gently, gently, gently. And it's going to take many days, but slowly you'll get rid of that cradle cap. Now, sudden infant death syndrome. This is why we put our babies to sleep and for naps on their back. Well, when I first started in newborn ICU back in the early 90s, they started to do research on SIDS death. And what they found is infants on their backs tend to have a higher incidence of death for no known cause in the first year of life. This is the first 1 year of life, okay? What they found was, as they kept going, that even on their side, they shouldn't put it, only on their back. So it's evolved. They used to say on their sides or on their back. No, only on their back can they be right now. Now, what are risk factors for SIDS death? Well, believe it or not, males are at higher risk than females for SIDS death here, okay? Cigarette smoke, that's ear infections, that's SIDS death. There should be no cigarette smokes around infants at all. Overheating, we tend to overdress our babies because we think they're going to get really chilled quickly. I mean, one more layer of clothing is all we need. We don't have to overburden that child with too much clothing. If they've just had any sort of upper respiratory problem, we want to know that their nose is going to be a little bit with mucus, so it can cause a SIDS death. Breastfeeding decreases the amount of SIDS death. So a bottle-fed baby is going to be at higher risk, okay? And then we know that socioeconomic conditions, it's too hot, it's too cold, immunizations that are not being given, and then cohabiting in the same bed with a mother and father. So those are your risks for SIDS death. Now, many times infants will come in and the parents will say, my baby held their breath and they turned blue and they scared me. And we call that an ALT, or an apparent life-threatening event. And it was an episode, whether it was a reflux, whether it was they just held their breath, they were angry, whatever it is, they held their breath. They put them into the hospital. They will be admitted and they will do a workup on these children to make sure it's not something neurological, or is it something GI that's causing this? And they will send the child home on an apnea monitor. Now, that is a picture of what an apnea monitor is. It's just this little Velcro strap with two probes, has respiratory and a heart rate, right? And it's just going to tell me if the heart rate goes too low or too high, and respiratory rate too high, too low. And it makes the most obnoxious alarm. It is the highest piercing. It's going to wake up anything. I mean, it's that piercing. and it will wake the baby up, wake up you so you can go check the baby. Now, safety promotion, all age children. Motor vehicle safety is number one, all age children. Infant to adolescent, number one safety problem, motor vehicles, okay? I can't enforce that more, motor vehicles. Now, other things that we do for our children at home is, today we're doing a lot on teaching them massage classes and CPR on newborn infants. And, we're offering those to new moms and dads to help. And also water safety. In my house, I've got a pool in the backyard. And, my grandson, who is now just turned 9 on Friday, was raised here a lot of the time. He was always with grandma, of course. And by age 2, this child could swim. No swimmies. He would do back flips, front flips off the diving board. He don't care. And he could swim, but he would never go into that pool without an adult watching him. He did it one time. He was yelled at so hard by his pop that it scared him, and that he will never do it again. So water safety. I've seen children drowning and then end up, not what they were before they drowned. So again, water safety, very important. So Letitia is a breastfed infant being seen in the clinic for her 6-month checkup. Her mother tells the nurse that Letitia recently began to suck her thumb. Which of the following is the best nursing intervention?
That's Latasha.
Latasha for Latasha?
I'm saying
Remember,
it's C.
yes, it's absolutely normal. What do infants do? They explore the world. And how do they explore it? In their mouths. Remember what Freud says. It's all about exploring the world in their mouths. So absolutely normal. So these are those theorists that you're going to need to know. Okay? From infancy to preschooler, they're there. So let's talk about infants and the first theorist, Erikson. Erikson talks about how that child responds to people around them, okay? Psychosocial, people around them, and how does that child call them, react with them? What's that all about? Well, what does an infant do? They cry when they're hungry, or they want you, or they're dirty and want changed, right? So they trust that you're going to come get them, because every time I cried as my baby, I'm crying, you come get me, you feed me, you change me, and I'm happy, healthy, and I'm a very well-adjusted child. Well, there are some infants that, for whatever reason, do not get picked up and their needs met all the time, not just one time, because everybody has one time they can't get right to that baby, but all the time. Consistently, they're not getting to that infant. So this is what we call mistrust. They say this could be happened a family that was either an alcoholism or drug abuse. These things they're thinking about more themselves and not about that child, okay? And that's absolutely, what we will see. A child that actually, they won't cry. They don't even look at these people anymore. You could see they're apathetic. They just, all right, you're not coming to get me. I'm not going to cry. I'm not going to lose my energy there. And believe it or not, young infants, you'll see it. Now, Piaget. Piaget, for that first up to 2 years of life, is all about figuring things out, cognitive thinking. Piaget says at birth, a baby had to learn how to breathe. They had to learn how to suck, swallow, and breathe a breast or a bottle in their mouth, right? They didn't know how to do that first. And then basically there's these schemas, whatever that means. What's a schema? Well, the first thing we did was we did a reflex and we grabbed that rattle and it's in our hand, right? The baby just reflex. It was there, so I grabbed it. They didn't know they did, but all of a sudden their hand's around it. Then their hand moved and that rattle made a noise. Oh, I like that. So now every time, because object permanence, they know it's still going to do the same thing or the toy's still there, that if they shake it, it's going to make a noise. So every time now they pick up that rattle, they shake it because they like that noise. Well, what's the next schema? Oh, it fell in the mouth. And oh, I like putting things in my mouth. I explore the world in my mouth, and now I put it in my mouth. So you can see how we've gone from a reflex into voluntary. Nom, nom, nom. Now I can take my rattle and eat it because it makes me feel good. So you see how you build from little and build into more and more understanding. Okay, that is Piaget. As we get a little older, that pre-operational, now we're using things like taking a block and using it as a race car, using a broom as, a witch's broom or, a car riding around. Arms out, now I'm an airplane. That becomes more. So it becomes even more involved, cognitively aware, okay? I'm not going to go into school age yet. That's a little bit more. But as children, that sensor we learn and we build upon those little cognitive understandings. We shook it, it made a noise, we put it in our mouth. Oh, I like it. I'll put it again. And as we get older, now I am using these things that I have found, a block of this or that. And now I am doing things with them. I'm using magical thinking and I'm figuring things out now. So, body image. We always put little infants in front of mirrors, or their little PlayStations always have a mirror in there for to look there, right? So, again, they're starting to learn things not only here around them, but all around them, trying to figure it out. As I said, the mouth is the principal area of pleasure. It gives them that pleasure. It's basically they explore the world in their mouth. As I said, object permanence. I know my little grandson was here for a little bit yesterday, and he's 8 months old. And, he's the type that he knows that Nana's going to have his toy. So he's looking at me and saying, okay, where did it go? I want it. And he's trying to reach for me at 8 months. He's telling me, where's that toy, Nana? Bring it to me. And of course, Nana gets the toy and gives it to him. And of course, he smiles and he's shaking that little toy around. And that's just part of what the first year of life's about. Socially, how they deal with people around them. Well, we know babies and young toddlers, they want who their caregiver is. They want their mommy, their daddy, their nana, whoever they're used to. That's who they want. They get that separation anxiety. We're going to go into that a little bit more, but there's 3 levels of separation anxiety. And this is when these children, you try to give them to a caregiver. Let's say you walk into the doctor's office and the nurse wants to weigh the baby first. It's the first thing we do. We have to take the baby out of the arm and put it on the scale. Many infants don't like that. So I would always have mommy or daddy put them on the scale for me, please. It takes care of that separation anxiety and it takes care of stranger danger, doesn't it? So that's what I would do. Another thing is we know as they're getting a little older, it's that peekaboo thing, stranger danger. So again, using play to make yourself seem less threatening. Because remember, all we do to our infants, we give them needles all the time. We see them, we weigh them, we change their diaper, and we give them shots in their vastus lataris, right? This is what we do. We know infants now, they're learning more and more, the cooing and the crying. And of course, by age 1, it's one word. It's mommy, daddy, milk, more, juice, whatever it is. And of course, how does a child explore the world? It will always be play. Okay, let's get to our first cahoots. Now, infants is always a lot of extra stuff. It's more than any other area. That's why I separate this one. Hold on. Remember, I don't look at these names. I don't look at who got what right, what wrong. That's not my purpose of this cahoots. My purpose for cahoots is for you to have something that you can go back and look at and test your concepts on, okay? So don't be afraid to put your name. You don't get marks up or down or nothing. This is for you. All right, we're going to get going. In general, an infant should triple their birth weight at what months of age? I know you know this one now, don't you? So we double at 6 months, we triple at 12 months, and then I'll let you know 2.5 years is when we quadruple. It takes that long. So you can see how much growth that first year really is. An infant should blank their birth weight by 6 months. Okay, 6 months we double, and 1 year we triple. Very good. A multi. Infant nutrition includes. I can't put everything in all of the PowerPoint. So these extraneous facts, like talking which ones here that they include, is something I'm going to put in the cahoots for you. So one of the things about infant nutrition is no honey for the first year of life. And the reason why they say that is they don't know how it's been processed. They don't know if the baby's immune system can tolerate it. We don't know the sterilization, et cetera, with it, okay? Another thing, no cow's milk until 1 year old. Now, at 1, you can take the child off of breast and off of formula and put them on cow's milk, whole milk. They need the fat for their central nervous system, for their cognition, okay? New foods should be introduced one every 4 to 7 days. And you don't have to avoid finger foods until 12 months. You just got to give small enough pieces that they don't choke on them and that they're soft enough that they can gum them to death, right? In order to get that food in. But yeah, they can still have finger foods. What about those puffs I was telling you about on that little, high chair, right? They can have them. Multi. Infant nutrition for the first 6 months. So, nutrition, first 6 months of life is either breast milk or iron fortified formula. Okay. Is it lactose free? But it's still iron fortified formula. The thing is iron fortified because mommy's iron's going away. We have to replace it somehow. A multi. Nurse nutrition interventions for an infant include. So, infants, what do you need to be concerned about? Nutrition. So, vitamin D is going to be given to children who are on breast milk. They need that extra vitamin there. Also, formulas, I don't care if they're soy based, this base, that base, but iron fortified. Again, they need that extra iron. And as I said, solid foods can be introduced at, the book says 5, 6 months. We say 6 months is our cutoff. one at a time every 4 to 7 days before adding a new one, because we want to make sure they don't have allergies. I mean, my grandson, Christian, has a really severe nut allergy, pistachios and walnuts and those things, not peanuts. And he just blows up like a crazy person. So knowing what it was the first time, we can avoid him all the way through. And that kid will not eat nuts without telling you, I'm allergic to nuts. An 8-month-old infant should be expected to perform which fine motor skills? Fine motor, F, fingers. That's how you read these questions. Which one is fingers? 8-month-old. Well, I know 8-month-old should be sit unsupported, right? Without help should be sit unsupported. I know that one. So we also should grab the rattle, and then we're also doing that pincer grasp. We're taking those Cheerios or little puff things and smooshing it in the face. That's a crude. Define pincers when they take one at a time and very carefully. And you have some infants that do that also. Which of the following is an example of fine motor skills in infants? Fine motor skills. Remember the question, F, fine, fingers, right? Fine motor. And you could rule out that whole question just by knowing that, can't you? And it's grasping. That's that get up and go, go, go movement. Perfect. You're understanding what I'm telling you. Which is the correct order for development in gross motor skills in infants? So this is a child where they can hold their head up, and then they're going to start being able to roll over 5 to 6 months. And then about 8 months, they can sit unsupported. Then by 9, 10 months, they're going to stand up and be cruising, stands with help. And then they're going to start or attempting to walk by 12 months. At what age can an infant typically sit unsupported? I've said it a few times. 8 months old, they should be able to sit unsupported, which means, yes, they can sit up at other times, but you're holding them in with pillows or propping them with things and holding them up. This, they just sit there by themselves. That's at 8 months. At what age does an infant typically start rolling over? And the one thing I want to caution you on, please don't think what your children did, because it's going to be different than the book. And I know some of you have many children. Forget what you have, go to the book and look at it. Some children, and my Christian at 2 weeks rolled over at the first visit at his pediatrician office. And the doctor went, oh my goodness, he's a little bit quick here. But usually it's 5, 6 months is when they start to turn over. First abdomen to back, and then back over to their abdomen. An infant's head circumference is? So at birth, an infant's head is big, and it's bigger than the chest. And one of the things we do as growth and development and milestones we look at the chest in relationship to their head circumference as they get bigger. So the head is bigger at birth, but by about 12 to 15 months, the chest is going to be equal, or the chest is going to be bigger than the head, and that is normal. How do you apply nystatin to an infant with thrush? I was on a Kahoot last week, wasn't it? Again, this is an infant, it's not an adult. An adult, you'd swish and swallow, right? But an infant, no, absolutely not. You're going to take a cotton swab and take it, and you're going to just paint the area where that whiteness is on their tongue. You try to squirt it in their mouth, they're going to gag and swallow. So just wipe it on where you see the thrush. Blank is contraindicated for treating fever in children. So we do not routinely give aspirin to children for a fever. We give acetaminophen for the first 6 months of life. We do not add ibuprofen, naproxen, any of that other stuff till after 6 months of life. Apparently with NSAIDs, there's something to do with platelet and coagulopathies, bleeding, and infants. We do not give them ibuprofen before 6 months old, okay? So before that, it's only acetaminophen. What happens if we give aspirin to a child? Well, it could cause Ray's disease. And it's basically caused by having a virus and then treating with aspirin, some metabolic thing that goes on, and these children get extremely ill. So we don't give it routinely. What is the primary goal in treating a fever? Do we have to treat a fever? So, how do you feel when you have a fever? You feel terrible, don't you? You feel achy and in pain. But once you get that fever down, don't you feel a little bit better? Look at a child. When they have a fever, they're sitting in the corner, sucking their thumb. They don't feel well. They don't want to eat. They don't want to drink, right? Give them that whatever it is to reduce the fever, acetaminophen or the ibuprofen. About 20 to 30 minutes later, all of a sudden this child's going to be wanting to drink, maybe wanting to eat, and it's going to play a little bit. So get that fever down, reduce that discomfort, and now you're getting the fluids in which they need, right? Because with fevers, you lose a lot of fluids and they could become dehydrated very quickly. So all of that, reduce discomfort and get them drinking. Infants Erickson stage. What does Erickson say about infants? Remember, Erickson is about psychosocial. How do they respond to people around them? This is how you have to think about these theorists. Infants. What do infants know? They just know that if I'm hungry and I cry, somebody's going to come get me, change my diaper, feed me. Very good. Yes. Trust. Which pain scale is used to assess an infant? I think only one person had that question wrong on the quiz today. So good job, guys, because this is a hard one. What's FLAC? What's FACES? Which one is it? So infant, which means 0 to 1. Yes, it is a FLAC. It doesn't change till FACES till they're 3 years old. A multi. When is the best time to assess an infant? So when you have an infant that's asleep in mommy's lap, this is the best time to listen for two things: respiratory status and listening to the heart, okay? Think about an infant when they're awake. They're always right, and they're moving with every touch, and they're cooing and making these noises, and you can't hear as well. So best time to assess an infant is when they're asleep in mommy's arms, because you're going to listen and be able to hear it a lot better. Where should you place a car seat for an infant under the age of 1? Car seat safety. Know that you're always going to see safety questions in pediatrics and infection control. Always, always, always. So you get a baby, an infant, it's going to be rear facing in a back seat, okay? And this is to protect the infant. When do we turn it around for a toddler? Age 2 or 30 pounds. Now, my little Christian was 2 years old, and he only weighed 22 pounds. He was a peanut at that age. The pediatrician says he's age 2. It's the muscle control in his neck. That's why we can turn it around. It wasn't the weight there, just to let you know if that was ever an issue. Which of these does tummy time help with? So tummy time, it gets them off of the back of their heads, and it gets them moving and looking for things, that object permanence, looking for that rattle. I know it's there somewhere. I'm going to go looking. Also, it helps with that flat head, right? I told you it's one of the things that just that little bit of tummy time helps that head round out. In fact, if a mother ever came to you and say, what can I do to help that flat head? Put them on tummy time when they're wide awake and alert. Put them on their tummy, and that does help. Which newborn can have ABO incompatibility? Do you remember this from OB? What happens with ABO incompatibility? This is when they get that hyperbilirubinemia, right? They turn yellow and they need the lights because their blood cells are exploding and putting all of this into the system, right? So it's basically mom and baby have different bloods. That's what it just means. And the thing about ABO compatibility is to monitor for their hyperbilirubinemia. Now, how do you treat before you even know what's going on? How can you, as a nurse, treat ABO compatibility before you even know it's there? And that is feed the baby, right? Hyperbilirubinemia or high bilirubins on babies are treated by a light, but by feeding. So feed, 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 feed. Give them the milk, make them stool, make them stool. You will see that black meconium start coming out in their stool. Which intervention may decrease the incidence of physiologic jaundice in a healthy term infant? So we're not going to tell you to put the baby by the sunlight next to a window. No. Initially, what we're going to say is feed them, feed them, feed them, feed them, feed them. Let's get that GI system moving. Now, when you send them home, are you going to say maybe put them by the window if that's what you want to do? I remember with actually both of my children, they said at 10 or 2 in the afternoon, put them outside in 20 minutes naked in the sun. I mean, that's what they said way, way, way back then. But we know if it's really bad today, they're going to send you home with the lights so that you're going to be giving that at home care now. And I know that's what happens. But as a nurse, what are we going to tell that parent? Keep feeding that baby as much as they want. Keep them stooling. A baby is NPO due to their medical condition. What's important to remember? You're going to find some diagnoses that you can't feed the baby. 'Cause if you feed them, that food goes directly in their lungs, let's say. That's one of them. So we can't feed them because they're going to be aspirating. So, what do we need for normal growth and development on an infant? And that's all about non-nutritive sucking. That's a pacifier. Because remember, they explore the world through their mouths, they calm themselves through their mouths. So give them a pacifier and they can take care of their own stress that they're feeling because they can't suck, swallow, and breathe, right? They have nothing. There's no food to eat. A multi. The mother suspected of having Munchausen syndrome. What should be in the care plan? Does anybody know what Munchausen syndrome is? Munchausen syndrome is when a caregiver does harm to a child because they like getting medical care. I've seen things like injecting toilet water into IVs or taking dirt and putting them into wounds, feeding them foods that will make them sick. Munchausen syndrome, very hard to diagnose, but if you have a suspicion, there's a kid that's always getting sick, it's not getting any better, and the same thing is going on and on. Munchausen syndrome is usually the main caregiver of that child, whether it's the mother, the father, the caregiver, or whoever it is. Okay. When that person, whoever suspected, whoever that person is, you must have somebody in the room with that person at all times. Not all the time, but when that, let's say it's the mother comes in, you need to have somebody in the room making sure they're not doing anything to harm that child. Also, you need to inspect anything that they bring in because it could be food, juice, anything that could be harming that child. This is a very sticky situation. Munchausen syndrome. The mother's actually trying to harm the child to keep them sick. A multi. Frequent developmental assessments are important for which of the following reasons? Select all. So why do we do developmental assessments? Well, we do these to make sure that our infants are where they should be, physically and mentally, right? So we can see if we're doing regular developmental assessments, we can say, are there any delays? Are they where they should be? Or are they behind? Okay. And we know early intervention can catch up any kid. I think the best thing about children is they're so resilient. You have a child who, let's say it's speech that they are not caught up with. My first two grandsons, they both were placed in speech. I'm telling you today, you can't shut them up. I mean, these kids are going and talking forever and ever in words that are crazy, but I'm telling you, they catch up so quickly. And that's what the great and the beauty about children is. What's Moro or startle reflex? What is that? Moro's reflex. It's an infant. A lot of times, Moro reflex could be a slam door. It could be that you bumped against their crib or their isolette and you startled them. And it's their hands and their feet come up like that. And it's basically they got startled. You did something that, ooh, I got scared, whether it's a noise, whether it's a jostle, a hit, something. They got startled. Arms and feet up. A multi. What are risk factors for SIDS? So when we're talking about children and we're talking about Sid's death here, the thing is males are more than females, okay? Smoke in the house. And then that upper recent viral illness, remember they get the mucus in their nose. To suck, swallow, and breathe is like a really, really difficult thing to do, right? So put a little mucus in their nose, and now that's your risk factor for SIDS. And last question, the rooting reflex, what's that? What's the rooter-tooter? So the rooting reflex is when you take and you stroke the cheek where the baby's going to turn to either get the bottle or a breast. So it's basically to have them eat, to show them, oh, over here, get what you need to do. And they respond to that, just stroking their cheek, rooting reflex. All right, let's see how we do with our infants today. Number 3, WS. Number 2 is ET go home. No, don't go home yet. And number 1, Joni. Number 4, Susan and Natalie. Good job, guys. All right, so what we're going to do is we're going to go further now. We're going to go into our toddlers and our preschoolers, okay? Any questions? Okay, chapters 32, toddlers. Now, toddlers are unique individuals. They are ages 1 to 3. These children are self-centered. They don't think about anybody but themselves. This is me, my mind, I do. And I love the Seinfeld quote there. Having a 2-year-old is like having a blender without a lid, turning it on, and they're everywhere all at once, all over the place. It's hard to keep up with a toddler, okay? Intense environmental exploration. Because remember, cognitively, they don't know this stuff. They are so thirsty to know about everything that they're into everything. You got to be careful. Safety, safety, safety with toddlers, very important. These children, temper tantrums, as I said, obstinacy, negativism, me, mine, I'm going to do it, right? That's your toddlers. Now, the first year of life, they've gained a lot of weight, right? They've grown tall, and now everything slows way down. Everything's slow now, okay? As I said, that birth weight quadruples at 2.5 years. It tripled at 1 year. It took another year and a half to get there, right? And then head circumference is equal to or to the chest at this point. Now, toddlers, they're all in now and getting to the point where they're going to be potty trained, right? We know that they're going to be getting all sorts of viral illnesses because what do toddlers do? They play with toys and they put it down, and then another toddler grabs it and puts it in their mouth, and they swap spit all day long, exchanging germs and viruses, and basically building up their immune system as they get older, right? I know it sounds horrible, but it's what they actually need to do. So by the time they become school age children, they'll stay in school because they've already had these things. We know that most of their physiological systems are more mature. Their upper respiratory infections, common, because everything in their mouth, right? We know that we have no problem with them with worried about thermoregulation. They maintain their own temperatures now. And now we're starting to do that potty training, understanding when they need to, move their bowels or when they need to urinate. They're starting to be aware of these things and to control those things. Their gross fine motor development. So throwing a ball We're starting 18 months can throw it. And we're starting to use both hands now, 12 to 15 months, and getting more coordinated as we get up to the older toddlers there. Visual acuity, they're starting to get more and more depth perception. Remember those two eyes that were binocular? Now they're working together. Now I can figure out where things are and I can reach them because my eyes are both working together now. Toddlers are now going to become what we call picky eaters. Now, as an infant, your infant ate everything and loved it and ate more. And you were like, how did they eat this, drink this stuff? Oh, it's just terrible. It's just, blah. But the infants love it, don't they? Oh, I love it. Well, when they become infants, this changes. All of a sudden, they don't like much of anything. I say if you have chicken nuggets, macaroni and cheese, and apple juice for a toddler, you're golden because that's one thing that they'll always eat, right? But they can't always just eat that, okay? Yes, they are picky, but you're going to have to try to fit in those new foods so they get the nutrition that they still need in there, okay? Now, psychosocial. Erickson, how does toddlers deal with other people? Well, they don't. Autonomy, automatically me, mine. Autonomy, right? Now, the other people are shame and doubt. They're saying, hey, be careful, don't do this. You're going to fall down. Hey, let me help you. Let me put that on for you. Let me tie that shoe for you. Let me. The helicopter mom and grandma behind the child doing everything. That's the shame and the doubt. That toddler wants to do everything by themselves. Okay? They want that. That negativism, no. That's what they say. Now, how are we as a nurse going to work with these children in whatever setting, in a doctor's office, an urgent care, admitted to a hospital? I mean, how are we going to work with them? Well, it's that rituals that they do. Ritualization that provides a sense of comfort. What does that mean? Well, the same foods if we can, if they're on that diet. I think the biggest one, especially with cognitively delayed toddlers and preschoolers, is that routine, which is bath time, believe it or not. Is it in the morning they get their bath, or is it at night when they get their bath? When do they change into their day clothes? When do they change in their, jammies? These are those little things you think are non-understanding, but I'm telling you, children, cognitively delayed and young children, this is the one thing that they know. So keeping them in that same routine gives them a sense of comfort. Another thing that psychosocial says is that id, ego, superego. As I said before, Kohlberg, it's all about that ego. They don't really have one yet. Infants and toddlers don't really understand id, ego, superego. And it's all about, is it mine? Can I share it type thing? If when you're an id, it's all about me and mine, okay? But that's what they are. By the end of toddlers, they'll come out of it in the other end and they'll share. But again, the psychosocial is now all about me, mine, and there's absolutely no right or wrong here. They don't understand morality yet. So, cognitive development. Piaget, sensory or motor. This is that again, as I said, that first up to 2 years, it's all about sense, touch, feel. What does it feel like? Is it soft and smushy, hard? Is it, soft? Is it fuzzy, cold, warm? And then it's oral in the mouth because everything's explored in the mouth. And then let's move it around, motor, let's make it work here, right? And that's part of what children up to age 2 do. And that's where they're starting to remember that toy's still there. I know it is. Let me go find it. And that's that object permanence. As I said, when they get older, thinking, now we're using things like the block and making it a car and a broom and making it, like an airplane and arms out. And all of these things are then pre-operational, where we start using what we have seen, okay? Sensor and motor, we're exploring. Pre-operational, now we're using the broom block that we've seen, okay? And there's a couple slides here that said the sort of things, but it goes over the same thing. Now, toddlers starting to explore themselves. It's very common that they're looking at girls and boys and differences. Remember their potty training. So now they're seeing differences in mommy and daddy and potty training. They know there's difference. So about 2, they understand boys and girls and that play in house and I'm the mommy and you're the daddy. These things are common, absolutely common. Separation anxiety, toddlers, they really don't want to be separated from anybody. And we know that if we have to get them separated, that transitional objects like what's their favorite blanket, their favorite toy, what gives them comfort when mommy's not there, those things are important for a toddler. I know that my little Christian had this little giraffe, but he called him Mr. Puppy for whatever reason. And that thing up till he was 4 years old had to be everywhere with him because it gave him that comfort. That's a transitional object. Now let's look at their language, toddlers. So at the age of 1, they have one-word sentences: mommy, daddy, milk, mine, puppy, whatever the one word is, right? By age 2, it's multi-word sentences. I want juice. I want milk. I want whatever. They can tell you things more. The toddlers now, remember, me, mine, I do it. They want to be independent. They want to feed themselves, play by themselves, dress and undress themselves. They can't do it all correct, but they need to try. Okay, we need to back off and not be the helicopter mom, dad, or nana. Let them try it themselves. Okay. We also know that toddlers now are starting to be aware of other people around them and feelings for other. I know that if I didn't feel well, or let's say I had a joint that was hurting me, I had an ice bag on it, I know Christian as a toddler would always be up giving me a hug and kissing my knee and say, oh, your knee's all better now, Nana. Because they start to understand these things. Play. Do we understand play yet? So, toddlers, what play do they do? Me, mine, I do, I ain't sharing. That's parallel play. That's totally, completely parallel play, right? Toddlers, parallel play, okay? Now, what else do toddlers do? Well, they potty train, and they've got to be ready to do it, and they'll just let you know. If they are dry for 2 hours, they're probably ready to potty train. Remember, bowel training happens before urine. Okay, they can feel the stool there. So stool is always number 1 that they do, and then it gets into that urine. Temper tantrums are always toddlers. Me, I do it, mine. You can hear the temper tantrum occurring, right? Absolutely common. Negativism, how many times do you want me to say me, mine, I do? Autonomy, automatically mine, I do it. That's about that. And then we know anybody who's not feeling well, even your husband of 68 years, when they don't feel well, they're going to regress it and be like a child, right? That's just what they do and what we do as being sick. So do kids. Nutrition. So the physiologic anorexia moment, right? So we still have to make sure that our children get enough nutrition. So I've mentioned it before, I'll mention it again. So what if you had a child who was lactose intolerant or was on a vegetarian diet? These are children that could be lacking protein or be lacking vitamin D, calcium, anything in their diet, right? you've got to make sure you replace it in another way. Like, for instance, vegetarian, are they drinking whole milk? If they can't drink whole milk, are they getting a calcium or a vitamin D supplement? Okay. If they're worried about protein, because remember, protein's all about wounds and healing and good wound health, right? So you need to make sure they have enough protein in their diet. So remember, even though children don't, or because of whatever, they're not going to be eating certain things, making sure that they get it in another way. That's what this is talking about here. Dental health. So, as I said, babies, as soon as their teeth comes in, fluoride, brush the teeth, no toothpaste. As we get older, they say flossing when they're old enough. They say it's not till about 6 years old when they have the ambidextry to be able to uh, floss their teeth correctly. I mean, they've got those little things now which are a little bit better, but they say in the book, they say flossing is after 6 years old because then they were able to do it. Again, using fluoride and preventing childhood cavities in their mouths. Now, what do children do with everything they see and explore? They put it in their mouths, right? So there is a lot of concern about poisoning, right? Lead poisoning, any poisoning. So today there's all sorts of treatment that we can do. If it's a lead problem, and this we'd be concerned about with paints and older buildings, and children, especially toddlers, like to go up to the windowsills and chew on the side of that little the little windowsill, right? And if that paint has lead in it, they could get lead poisoning. And it happens just like that. Know that there are medications, and then this apheresis machine, which is similar to this one that's on this page. Basically, it pulls the iron off so that they don't have those untoward effects of iron poisoning. So, what do you think is the most common of all ingested medications that children take and are rushed into the emergency room for? Believe it or not, it's Flintstone's chewable vitamins. Kids love their vitamins. They think they're good and they get a hold of them and start chewing on them. That's the most common. Now, I have seen mama's cardiac medicine. I have seen too many aspirin, acetaminophen, ibuprofen, but the most common is actually the Flintstones vitamins. Now, as a nurse, what do we tell parents if they ever take something that they shouldn't get? What should they do? Immediately. Don't do anything to the kid. Immediately call poison control. They're going to tell them, do they need to drink milk? Do they eat a cracker? They're not going to tell them to throw up anymore. That's passe. That's years ago. They used to give them Epicac. No, we don't do that because it could burn on the way up, could aspirate, could cause more problems. Okay? And then safety promotion, injury prevention. Toddlers are into everything. It's being in the car seat properly, turning it around when they're 30 pounds, making sure that they're buckled in properly. Drowning is a big thing. So water safety and teaching them burns, falls, aspiration. Again, motor vehicle related injuries are always number one for unintentional injuries of any age child. Putting a car seat on, make sure that it's in the back seat and rear facing under the age of 2. With these harness type of things that they have today, make sure that those shoulder straps fit snugly and it's actually in the center of the back seat. You can use blankets and roll up things to roll around, to hold and snug them in there, especially the young ones, especially coming home from the hospital. They're so tiny. And no, actually, there is an expiration date on car seats. So there's more gross motors for you to look at. And now, preschoolers. I put these two together. So preschoolers are ages 3 to 5, and it's basically right before school. These children are more apt to want to be open to learn. There's increased attention span, and they like to be with other kids and they like to learn here. Their physical growth, again, like toddlers, slows way, way, way down. Okay, maybe 5 pounds a year that they grow, 2 to 3 inches. Not much, but slow and steady. Their body systems are maturing, okay? And preschoolers can adjust to a little bit of stress. Toddlers cannot. Preschoolers now have more of that ability. Gross motor skills, preschool, walking, running, climbing, jumping, they can do all that stuff good. Fine motor, they're dressing, they're drawing, they're cutting, all of these things they're doing now. Now, psychosocial. Psychosocial is a child dealing with other people. That's Erickson. What does Erickson say? Erickson says that these children have a sense of initiative. This means that they want to do things, they want to help, okay? But they have a feeling of guilt when they do something that wasn't what they should have done. They could have done something better. They want to do things good. They're almost to the point of pleasing. That's more school age, but they still want to. And they're beginning to have that ego, that super ego, that conscience. Okay? And remember, preschoolers are starting to understand right or wrong. Remember Kohlberg? They're starting to understand it now, and they understand reward and punishment. So preschoolers, we need to get them ready for school and for learning, and to be placing them with other children so they know how to get along with other kids, whether it's putting them in a gym class or something else we should be done. And parents should be reading to that kid every day. Cognitive development. Now we're more into taking what we've learned and now using it magically. Okay, this is magical thinking and making things, float and be magical. Their toys do things, and they're really enjoying figuring things out. One of the things we talk about is time. Now, time is not understood by a preschooler. What does a preschooler understand? They understand after you have your nap at school, mommy's coming to get you because you're going wherever. Or when you wake up in the morning, when the sun comes up, we're going to Disney World. Or when the sun goes down, grandma's coming over. You see, they understand time with an event. They don't understand the numbers on a clock. Kohlberg, again, remember, right and wrong and a consequence for each. But again, preschoolers, reward and punishment is what they understand. That's right and wrong. Preschoolers are so afraid if they get cut and they bleed that their body blood is going to come out and they're going to die. Why they understand that, I'm not sure, but I'm telling you, a Band-Aid serves, Band-Aids are everything for preschoolers. Put a Band-Aid on it, the blood's not coming out, and they're not going to die. But they're afraid of everything, like needles and things that go into them. They're afraid of all these intrusive things. So again, explaining to these children what's going on. Explaining, is it going to hurt? And being honest with these kids. Again, being honest is important. Spiritual development is what the families taught them. They're still preschoolers, ages 3 to 6, 3 to 5, right there, where they understand what mom and dad and grandma and grandpa and the whole family talks about. They don't understand more than that yet. It's only what they know, what the families taught them. Another thing, and we've talked about it already, about culturally, some believe that punishment something happens bad, it's because the higher power, they did it to you. Because you did something bad, this happened to you. A lot of people, cultures believe that. Preschoolers, sexuality. Yeah, they start to understand boys like mommies and girls like daddies. They're starting to understand mommy and daddy roles that are coming here. They're starting to explore themselves, absolutely normal. They're starting to be able to be away from mom and dad a lot easier than it was for a toddler or even your infants. We know this security is derived from familiar objects, as in, okay, I got my favorite little stuffy toy. I can go anywhere because I'm all right. Or I got my favorite blankie, or I got my binky, or whatever that thing is. That helps them. And then another thing we do with social is play. Now, play is not obtrusive. Kids love to play, and we could figure out why they were upset with something just through play therapy. They've got child life now and a lot of programs in with your children, and child life goes into understanding them, and they understand developmental levels, and they could figure out, well, they were upset because they went to CAT scan and they did this, during the CAT scan. Maybe they touched something that hurt, or they were afraid of that big noise, or we can find out why. Preschoolers can talk quite a bit now. They're making up their own words, I think, at this point. Christian's word was teleportation. He just loved the word teleportation, and he teleported all over the place. And that was part of his preschooler words. And they're all going to have their own. Know that they become more and more, learning more and more. That ritualism that we needed as a toddler, yeah, we need it somewhat, but not as closely as we did with toddlers, okay? Preschoolers, they love to please. They want to help other people so they can dress themselves, all right? And, as preschoolers, they're going to start challenging things. And it usually is bedtime, is when they're going to start challenging that conduct. As in, well, my older brother can stay up till 10. Why can't I? Well, keyword, he's the older brother. So you're going to have to go to bed at 8 o'clock like you're supposed to. And he can go to bed at 10 because he's 12 and you're 5. So again, they're going to, try to challenge those things. Play. How many times you want to hear about play? Preschoolers. What are preschoolers all about? Well, toddlers are preschoolers. Toddlers, these are children, that it's me, mine, and they play by themselves, right? No sharing of toys. Associative play, now they're preschoolers. Guess what? They can share toys. They enjoy sharing toys. It's not a big deal. Another thing preschoolers have is imaginary playmates. Now, if they still have one at age 9 and 10, that's a problem. But preschoolers are allowed, and they're supposed to have the possibility of imaginary playmates, okay? Sex education. The one thing about preschoolers is many parents are having other children, and then sex education becomes, well, what is sex and how does it happen? Well, what is said is let the child knows what they know first. Tell me what you know, and then go on from there. Because they ask doesn't mean they understand all the ins and outs about it. So just ask them. What is said is you should use the correct anatomical words, and especially your potty training, right? Through toddlers and to preschooler. So, a penis and a vagina should be used as words. Again, be honest. Being honest with these kids, they're going to remember. If you tell them it's not going to hurt, it hurts, they will remember. Also, it is not uncommon for preschool children to masturbate. Not uncommon at all. And if we see this happening, say, okay, go to your room, do by yourself. We don't need to be watching you. I mean, don't make it a bad thing, but tell them where the place should be if they want to touch themselves. That's what's been said. They're afraid of the dark. They're afraid of being alone, and they don't like big dogs. They're afraid they're going to hurt them. They're afraid of ghosts. We always told Christian as he was going through this ghost stage, well, when the ghost comes out, could you tell him to come see me? I'd like to say hello to him too. So now we've made the ghost not threatening. And that's as a nurse, you can do those things. Why, if you feed upon their fear, make it to a non-fear. Hey, when they come, let me meet with them. I haven't seen them in a long time. Speech problems, as I said, we usually see that ages 2 to 4 when we institute some speech therapy. It could be they're not speaking or they're stuttering or they're stammering, all these things. We can help them with early intervention and speech therapy. These preschool children sleep also well. Yeah, they're going to give us a little bit of problem about going to bed at night because they're going to try to extend that. That's what preschoolers do. But one of the things, and my second grandson had him, was night terrors. He'd wake up, but he wouldn't be awake. Eyes open, but he wasn't awake. And he'd start screaming and yelling in the middle of the night like somebody was after him. And it was true and real night terrors, nightmares type things. And actually, he had to be placed on melatonin to help him sleep at night because of these night terrors. Very common in preschoolers. As I said, injury prevention, safety precautions are always going to be there. So remember, injury prevention, using helmets, knee pads, elbow pads, wrist restraints, all of these things, using what we should, very important. Increase in motor vehicle accidents on preschoolers. Why? Well, now they're being run over by cars. They're in the driveways running their bikes. They're not knowing that the cars are going to back up and hit them. Not everybody looks backwards before they back up. I've seen 3 different children back and ran up over in a car, preschoolers. 3 outcomes. One didn't do good. One after surgery did okay, and one nothing happened. Ran over by a car. 3 of them. So it is real. These things happen. So again, as they go onward into sports, bicycle helmets and everything they need, protective equipment for any sports that they want to do. Children are now, as preschoolers, going to school and starting to learn other people's opinions, right? You have teachers now inferring their opinions on your child about all different things. So their minds are becoming open now. Communicable diseases. One of the things I think we see a lot, chickenpox. And you think chickenpox, there's an immunization. Well, guess what? Just because there's immunization doesn't mean that you're not going to get the disease. It might be a less disease, but you still can get chickenpox with it. Knowing that chickenpox is spreadable when you don't even know that you have it yet. So knowing that chickenpox, once everything is healed and dried, they can go back to school. Conjunctivitis, big thing is eye infections, washing hands. Again, taking and washing the eyes from inner canthus to out, putting the ointment or drops in. Remember, if you ever put ointment in an eye on a child, let them know their vision's going to get blurry because they're going, oh my God, I can't see. What did you do to me? And that's what they might think. So again, be aware. Also, stomatitis, or those lip sores that can happen, cold sores, they hurt, they're painful. So making sure that we do pain relief and washing hands. I always tell any parents with these 2 things to change their pillowcase every morning, because if not, they're just going to put their face back into last night's germs. And it's one thing that I've learned, and it's no book tells you that. It's just what I'm saying. And then diseases, the worms. Kids go outside, they play, they get eggs underneath their fingernails, they put it in their mouth, the eggs go in and they hatch, and now they got worms. And now the worms, they can feel this little itchy, terrible feeling coming out of their anus at nighttime, and it's irritating. And the child will wake up, and try to itch their butt. Take a piece of Scotch tape, that little piece of worm, put it in a container to get it to the doctor so that we can treat it. And yes, there's medication that can be done. If one person in the house has worms, you need to test everybody. Most likely everybody's has worms. And then I think this is my most unfavorite thing to teach about because I've seen child abuse, maltreatment, neglect. I've seen it where physical, emotional neglect, where a child was strapped to a mattress in a room and the kid came to us. He had absolutely no body fat on him. He had decubitus on his face, where I guess his face was against the bed. His wrist, you could see where he was tied. He had decubitus on him, and he literally took his last breath when he got to the ER. We resuscitated him. We got him back. And 1 month later, the nursing supervisor brought him down to us so that we could see him. He made it and he was awake and he was alert. And it was due to child abuse. And I want you to know that that child is not put back into that situation. If you ever think that a child has been abused, it's better to be safe, get it checked, and to be sorry. Because, yes, this is the big, obvious. You can see belt marks here. Not all of them are that obvious, okay? Knowing that I've seen two different ones that I've reported that I've saved in my career from future abuse because I know that I did the right thing. That physical abuse, I told you, the bush housing, it's that factitious disorder. That means they keep getting these kids sick and they're doing things to keep these kids sick. Again, make sure somebody is with that child when the person who is, you think, is doing this bush housing syndrome is in the room to keep them safe. So parents tell the nurse that their 3-year-old daughter and a male cousin of the same age have been inspecting each other closely as they use the bathroom. Which of the following is the most appropriate response by the nurse? Remember, masturbation and finding themselves, feeling themselves as part of that exploration at that preschooler age. What should you do? So remember, these are preschoolers. They don't know right or wrong about touching themselves or anything. So what we do is, come on, let's go. Let's go get a snack to eat. Wash your hands, let's go. And that would be the end of that. As in, neither condone nor condemn that curiosity. Okay, let's do our cahoots and we'll be out of here in a little bit. All right, let's get going. A multi. Types of play considered to be sense pleasure play. So sense is anything with the fingers, the sand, finger painting, mashed potatoes. Yes, it's all about touch and feel. Very good. What type of play is considered cooperative play? And cooperative play is two or more children playing together and there is a goal. The goal in checkers is you win the game, right? Building a sandcastle by themselves? Nope, that's solitary. Sharing? That is associative play. Driving race cars? Solitary play. Do you see the difference? According to Kohlberg, pre-conventional level of moral development, a preschooler who has moral reasoning, what does Kohlberg say? So, right or wrong on a consequence for each, and preschoolers understand reward and punishment. Which nursing action is appropriate to teach a preschool age child about a scheduled procedure? So you've got this child ages 3 to 6, and they need to come in and have something done. How are you going to teach them? And this is a great age. Give them a doll, let them touch it, feel it, use it, show them where you're going to put things. Absolutely a perfect thing to do. Before performing a physical assessment on a toddler, the nurse should do what to encourage cooperation? Before you're going to do that assessment on a toddler, ages 1 to 3, how are you going to make sure that they're going to do what you need? So
Mhm.
when you go into a toddler, you're not going to go in and touch them right away. Yes, they are going to be using that play, but first you get yourself down, minimal touch, work it up, use some little, where's your nose, start those little things, minimal first, and then let them touch and feel the equipment as you get going. It's sort of a process. A 3-year-old child's having an outpatient procedure. What would you help the child to be less fearful? How would you do that? 3-year-old. And it's again a 3-year-old. It's a great age. Then give them a doll, show them what you're going to do, what position are they going to be in, all of those things. It will help them when they understand what's happening. Before assessing a 4-year-old child, what techniques would you use to approach this child? So you got down on their level, and now you're trying to build up rapport here, right? How do you do that? So children always have on those sneakers which have lights or have on some sort of comic sort of t-shirts and things. I always, when I see it, I'm going to ask them about it. Oh, you like Batman? Oh, I like Batman too. Oh, my grandson has that too. Oh, what do you like that he does? I mean, start with all of this imagination and on a preschooler, and guess what? Now you're not threatening at all because you're cool. You know who Batman is or Spider-Man or whoever that is. What technique can be used to examine a toddler? Ages 1 to 3. How are you going to examine a toddler? Remember, toddlers are probably your hardest of all children to examine, but when you use play, this is where we can do body parts. Like, put your finger on the nose and say, is that your heart? Or is that your mouth? Or is that your nose? I mean, these children will laugh and giggle and it'll be so fun. And now again, you're not threatening. When assessing a healthy child's lymph nodes, what would you expect? The kid isn't sick. What do they look like? You should not be able to feel them at all if they're not sick. If a child is sick, lymph nodes are your white blood cells that fight infections. That's when they get rounded and more protruding. So otherwise, you shouldn't feel them at all. Which Erickson stage of development levels would be used for a toddler? So Erickson, the way people around them respond to them. What is a toddler? A toddler is all me, mine, I do, right? And it's everybody else trying to do it for them, giving them shame and giving them doubt, right? Remember, toddlers automatically me, mine. That will always be always be Erickson and toddlers. Me, I do. And shame and doubt is when you're trying to do it for them, so they don't have the ability to do it and try. They need to try. What pain scale would you use on a 3.5-year-old child? So at 3, it becomes faces. Below 3, it's flat. A multi. Erickson's autonomy versus shame and doubt is used to describe toddlers. What does that mean? Automatically me, mine, right? They can do things for themselves. You need to try to let them do new things. If we don't let them try to put their shoes on, how are they going to ever put them on correctly? Or how about putting the clothes in the dirty laundry? If we don't let them do it, they're not going to know how to do it. And the shame is when we don't let them. A 2-year-old boy is playing with mud and dirt. What type of play is this? And that's called sense pleasure. It's all about that touch and feel. A parent of a 18-month-old boy says that he says no to everything and has rapid mood swings. Is that normal? Me, mine. I do. Absolutely normal at this age. Remember, toddlers are all, with themselves, egocentristic. They're about me, mine, and I do it. What is descriptive of preschoolers' understanding of time? So they don't understand 2 in the afternoon, 10 in the morning, but they understand when I wake up and the sun comes up, when the sun goes down, after lunch, after dinner, after I'm done with my bath time. They understand time related with an event. That's all they understand at this time. What age would most children could understand under, on top of, beside, and back of, and over, around? That's at 4 years. I mean, many of your children probably did it at age 3, but the book says it's age 4. They should absolutely be able to do it. In terms of language and cognitive development, a 4-year-old child be expected to what? So this is your preschooler. Preschoolers should be able to follow simple commands. Take your shoes and put them in the closet. Take your dirty clothes, put them in the laundry. Go wash your hands. Let's get ready for dinner. They need to be able to follow simple commands, and yes, they do. What pain scale would you use to assess the pain of a toddler? Again, toddlers are ages what? 1 through 3. So toddlers should be in the flax scale, okay? So that's 3 and below, which is flax scale. At 3, it becomes faces, which is preschoolers. A multi. What are the cognitive characteristics of a child ages 2 to 7 in the pre-operational stage? Remember, we started out with figuring things out and moving things around, and now we're taking these things and now we're using them in different ways, right? So this is where they become imaginative, that a block is now a car and a broom is something else, and my arm's out and I'm flying airplanes all over. Again, they don't understand other people yet, but they are very magical, very imaginative right now. They're not logical yet. Logic comes as a adolescent, okay? A 2-year-old has difficulty in activities, sensory sensitivity, and only speaks one-word responses. How are you going to assess that? So this is giving you some key hints here. Difficulty, activity, sensory sensitivity. This sounds like at 2 years old, it could be a possible child with autism. Now, I put this question in here just to show you that there are many different sort of checklists and things that we can have to assess different types of children. Not all children follow one single path. Children have all different things, and one of them could be one with cognitive delays, one that with autism, and there are special checklists. And this is what this means. There is some other types of checklists. What fine motor skill is expected of a 4-year-old child? Fine, F fingers. That's how you answer this question easily. So fine motors, F fingers, skipping is gross motor, tie in shoelaces, it could have been, but 4-year-old, that's a little bit too young for that. And walking upstairs, again, that's gross motor, so it's buttoning a shirt. A multi. What gross motor skills should a 4-year-old be able to do? Gross motor. So a 4-year-old should be able to walk upstairs using both feet, and you don't need to hang on to anything. They should be able to hop on one foot. Okay, this is part of they're doing more and walking on a straight line and not fall over. There's many different things, but these are the ones you need to know. Jumping rope is about a 6-year-old, and tying a shoelace is actually the same, and that's fine motor skills, right? Gross is movement. Tying a shoelace is fine motor skills. Multi. What would alert the nurse to hold digoxin on a toddler she was caring for? So, what do you look at when you give digoxin to anybody of any age? You look at dig levels, you look at electrolytes, you look at heart rate, right? So, what here's not where it should be? Well, toddlers should have a heart rate a minimum of 100 or higher, okay? So that heart rate's way too low. Digital level, any age, doesn't matter, adult or children, it's the same level, that's way too high. Potassium level must be of normal, which is 3.5 to 5. So that is also to be alerted. Bounding peripheral pulses has nothing to do with digoxin, nothing at all. We only look at heart rate, dig level, and your potassium, your electrolytes. How can you prevent otitis media in children? One of the big things is cigarette smoke, right? Cigarette smoke, it helps with SIDS death, prevents that. Also, as they get older, it's ear infections. So big things, cigarette smoke in children. A 4-year-old is reluctant to take medicine. What intervention should the nurse take? Working in the ER the last 10 years of my life, I can't tell you how many kids I had to give medicine to. And a 4-year-old who doesn't want medicine, it's hard to get that medicine into them. So what they say is just to use a straightforward approach. What does that mean? Well, would you like a chewable pill? Would you like a liquid? Do you want it in a spoon, a cup? Ask them that. That's straightforward. Now, if you put it with food or juice, medicine, and they don't take the whole food or juice, how much medicine did they take? You don't know. So it's not really recommended to put food or juice to take the medicine or put it in the bottle. Just don't do it. You need to give it separately in some manner. And they say with these preschoolers, straightforward approach, they should take it. Which intervention helps a hospitalized toddler feel a sense of control? So children, what you need is to follow that same routine for feeding and bedtime. Another one, even with cognitively delayed children, as I've said before, I'll say again, bath time. Is it in the morning? Is it night, in the afternoon? Maintaining the same bath time, believe it or not, that's the one thing that children really pay attention to. Multi. A child's been admitted with profuse diarrhea for 2 days. What would you expect? Now you're going to see some acid-base questions on a couple of these cahoots because one HESI had 4 acid-base questions on it. So I want you to know what's alkalosis, what's acidosis, what's metabolic, what's respiratory. You need to know these things. So if you're getting rid of whatever fluid, yes, you're losing potassium, fine. Diarrhea is alkaline. It's because of the enzymes for digestion. They're all alkaline. So if you get rid of all the alkaline with diarrhea, what is left? Acidosis. If you're vomiting, what are you vomiting? Acid. What do you have left? Alkalosis. That's how you have to remember, okay? Metabolic acidosis is diarrhea. Alkalosis is vomiting. Last question. Normal language skills for a 3-year-old child? They should do about 4-word sentences. They're getting more and more and more talkative, and they can put the words together now. Joni, good job, Joni. Number 2, KJ. And number 1, drum roll, please. Susan, good job, Susan. Good luck, KS, and good luck, Natalie. Remember that you do have a discussion question. I will be doing the ones from last week in the next couple days. Always remember to go back to the discussion questions and look at the comments I write. I actually give you some really good information and some ways to think. So go back and do look at them as I start getting them scored, okay? Anybody have any questions, comments, concern? No class next week, guys. We will see you for week 4. Know that next week also is going to be reviews for the exam. I'll be sending out a schedule for you all to go to, okay? With a study guide PowerPoint. It's ready. I'm just waiting to get it set up for you. Thank you, guys. Have a good
Thank
night.
you. You too.
My pleasure.